Hello, my name is Walter, and I will be presenting the Chinese culture. And to start, hi Dr. Lang, my name is Walter, and today I will be presenting the Chinese culture. To start, the Chinese has a very similar climate and vegetation compared to the United States. They're located in the continent of Asia. They share about 16 borders, and they are the fourth largest country with a very large population and 28 provinces. They speak several languages in China. They have hundreds of dialects with grammatical and phonological differences, group of language families. They have the Sino-Tibetan. They have the Altaic, Indo-European, and so forth as listed above. Communication norms for the Chinese, when you talk to them, they try to avoid eye contact because it's seen as a disrespect act toward them. They are very shy. If you talk to them, they're not gonna stare at you. They say yes to everything, even though they do not understand, because that's a sign of respect towards you. And the social role influence interaction. Physical and biological features. With the Chinese, they have lighter skin tone, dark eye and hair color, and their hair out straight. They have less facial hair and smaller noses and wider cheekbones. Family and religion. They are the most important two things in China. They take families and religions very important. So they have three forms: the Han, the Tibetan, and the Southern Buddhism. Believed to be spread to China in 1667-80. Profound influence on traditional Chinese culture. They utilize the temples, the cave, and the mountain for worships. Family structures. Distribution of power based on generation, age, and gender. Traditional versus modern. Patriarchal to equalitarian but authoritarian. Cohesive and loyal family support. Household consists of extended family. The healthcare belief and practice. Has the Chinese patient, they love to have the same sex. They prefer to have the same sex to care for them. And when it comes to illness, they do believe in food and medicine, especially hot and cold, according to perceived body effects. Health to the Chinese culture is positive balance between the yin and yang. They maintain Chai, disharmony of hot and cold, cosmic disharmony, and influence from evil forces. They use different type of alternative medicine. As we know, the Chinese culture, they are not the type that will go to the doctor for everything. They believe on home remedy or anything kind of alternative, nothing that have to do with Western medicine. Most of the time, they will try everything else before they try the Western medicine. So they do have some alternative medicine such as acupuncture, grouping, or diet alteration. Pregnancy and childbearing practices. Once a woman pregnant, they consider the woman to be healed until she gives birth. Their body is been disturbed from the hot or cold balance. They have special diet and soup. And lamb is not advising to eat during this period because they believe they can have seizures, or pineapple can cause miscarriage. Birth. At birth, it's good to remain quiet. The father is not usually be present. As a woman, they don't like to just lay in the bed and give birth. They will prefer squatting or sitting. The limited shower after birth. They does not eat with others due to lochia. And the sitting month. I'm not sure what is that referred to, but I'm thinking about a sitting bath, or they spend 1 month getting the hot bath, the sit bath kind of thing that we practice as well. Disease and high-risk health behaviors. Overall, less health problem than the Western society. Nevertheless, numbers rising. They have a lot of communicable diseases associated with poverty. Those are hepatitis, tuberculosis, and HIV/AIDS. And a lot of the Chinese culture and people, they do smoke a lot of tobaccos, and population and poor tobacco control is one of their environmental factors. How to provide cultural competent or cultural sensitivity care. We have to take a holistic approach to your client health. And as we know, the Chinese believe a lot in traditional medicine, so we have to kind of combine both as much as possible when we care for them. Combine the Western health care and the traditional remedies, and see how can we balance both of those in order to help them with their care. Patient may refuse pain medication. They don't like to take pain medication, especially when they are healed. Some of them felt like this is how they have to pay for their sins. So we have to be able to find alternatives such as comfort, provide them with comfort, position changing every 2 hours, a little back rub if they allow it, and so on and so forth. How to communicate with them. We have eye contact, handshake, physical contact, verbal cuings, and compliments. What to include in the health promotion education. Education in Chinese culture. We can talk about the traditional medicine, family role, imaginary, and collectivism. How to show respect for their culture. We have to know that the yin and yang is very important to them, and they don't like to mix hot and cold. The family function and decision making, the father usually the higher power, and the funeral arrangement. Refusal of treatment is very high, especially when we consider the Western medicine, because they are very big on homemade medicine. They have to try everything possible before they can agree with any kind of pills or any further treatment. They obey authority, knowledge, and harmony. Ethical question. The ethical question is, what should the healthcare professional do if a Chinese origin is resistant to quit smoking after receiving a diagnosis of COPD? Well, the first thing we can do, we can assess the knowledge about the disease, because if they're not knowledgeable about the disease, they will not be able to take what you're telling them seriously. So you have to make sure they're aware of the disease process, what can occur while they're smoking, and what action can they take as of right now to help improve their health. So we want to educate them. We want to plan a nurse patient contract with them, and what they're gonna do and what are we expecting from them. And we can intervene by providing medication as needed and evaluate the patient outcome. And listed below are my references. And thank you for everything, Dr. Lang. That was a good class. I learned so much from this class. So thank you for all the knowledge and all your help. Thank you very much. Bye.